Welcome to Section 7 of Genetics. In this section, we'll be discussing X-linked diseases. Here's a table of the X-linked disorders you need to know for Step 1. Obviously, there are a lot of disorders and they cover multiple organ systems, and for this reason, I'm not going to focus on the details of each genetic disease in this video. They'll be covered in more detail in their respective organ systems. In this video, we'll focus on Duchenne and Becker muscular dystrophy. There are 3 muscular dystrophies you need to know for Step 1, and these include Duchenne, Becker, and myotonic. Duchenne and Becker muscular dystrophy are X-linked recessive disorders, and myotonic muscular dystrophy is a trinucleotide repeat disorder. In this video, I'll focus on Duchenne and Becker muscular dystrophy, and then I'll discuss myotonic muscular dystrophy more in the video on trinucleotide repeat disorders. In genetics, you should know that larger genes have an increased probability of spontaneous mutations because there is more space for this to occur. The dystrophin gene is one of the largest in the genome, so it's commonly affected by spontaneous mutations. Both Duchenne and Becker muscular dystrophies are caused by dystrophin gene mutations. The mutations cause frame shift or nonsense mutations and ultimately result in dystrophin protein dysfunction. The dystrophin protein is present in muscle tissue and is responsible for anchoring actin to the extracellular matrix. If it's dysfunctional, it can lead to myonecrosis. Let's pull up an image so you can see what this looks like. This is a figure of the dystrophin protein linking the cytoskeleton to the extracellular matrix, and it can be found in Section 7 of Genetics. As you can see, the dystrophin protein provides structural stability to muscle cells, so when it's defective, this can result in muscle tissue damage. Again, notice that this protein connects the actin cytoskeleton to the extracellular matrix. Over time, muscle tissue damage causes progressive muscle weakness. In Duchenne and Becker muscular dystrophy, this usually begins in the lower and proximal limbs and progresses to the upper and distal limbs. Because the lower limbs are affected, patients will commonly exhibit the Gower sign. This simply means that the individual will use their upper limbs to push themselves up when attempting to stand. Eventually, the muscle tissue is replaced with fibrous connective tissue and adipose tissue, resulting in enlarged calf muscles. This is known as calf pseudohypertrophy. Because the heart contains the dystrophin protein, this disease can cause dilated cardiomyopathy. As muscle tissue dies, this causes creatinine kinase to leak out into the blood, resulting in an elevated creatinine kinase. Molecular tests such as PCR are commonly used to make the diagnosis. Becker muscular dystrophy is essentially the same as Duchenne muscular dystrophy, but rather than a frameshift mutation, it's more commonly caused by non-frameshift mutations, such as a missense or nonsense mutation. It's typically less severe than Duchenne muscular dystrophy because the dystrophin protein is more functional. Hopefully this makes sense intuitively. A frameshift mutation would result in a severely truncated protein, whereas a missense mutation would only slightly alter the protein structure. A 4-year-old boy presents to the physician due to a 3-month history of muscle weakness. His mother states that when he lays on the ground, he has to use his hands and arms to lift himself up. Physical exam reveals pseudohypertrophy of the calf muscles. Which of the following most likely represents the mode of inheritance of this patient's condition? Okay, from the question stem, hopefully you notice that this part of the question, when he lays on the ground, he has to use his hands and arms to lift himself up, is describing the Gower maneuver. The patient also has muscle weakness and pseudohypertrophy of the calf muscles. These findings are all consistent with muscular dystrophy. Because he is less than 5 years old and his symptoms appear to be severe, he most likely has Duchenne muscular dystrophy, which is an X-linked recessive condition. From the pedigrees, only A represents an X-linked recessive disease, so A is the correct answer. Recall that in X-linked recessive disorders, males are generally the only ones affected and there is no male-to-male transmission. So notice from the pedigree that only males are affected. B represents an autosomal dominant disorder, C represents an autosomal recessive disorder, and D represents a mitochondrial disorder.